Hey guys, what's up? Today we're going to discuss about a disease that affects millions of people around the world. And if that's what you're thinking, you're right. Let's discuss about diabetes. Diabetes is a chronic disease characterized by increased blood sugar levels to the lack or poor absorption of insulin. Insulin is produced in the pancreas and is responsible for transforming glucose molecules into energy. When this hormone is missing or when it's not acting correctly, there is an increase in blood sugar and consequently diabetes. The lack or malfunction of insulin can have a genetic origin, but can also be caused by bad habits such as poor diet and a sedentary lifestyle. Well, what types of diabetes exist? Prediabetes. Prediabetes occurs when blood glucose levels are higher than normal, but are not yet characterized as type 2 diabetes. In this case, the patient has the potential to develop the disease. Therefore, it is a warning sign, especially for people with risk factors such as overweight, obesity, and hypertension. Gestational diabetes. Gestational diabetes is increased resistance. Gestational diabetes is increased resistance to the action of insulin during pregnancy, leading to an increase in blood sugar glucose levels, diagnosed for the first time during pregnancy, which may or may not persist after birth. The exact cause is not yet known, but is probably related to hormone production. The type 1 diabetes. We have type 1 diabetes which occur when the production of insulin by the pancreas is insufficient due to a defect in the immune system in which antibodies attack the cells that produce this hormone. It is the least common type and appears from birth. Type 2 diabetes. The type 2 diabetes affects the way the body metabolizes glucose, so the patients may be resistant to the effects of insulin or not produce enough insulin to maintain a normal glucose level. It is the most common type, and it is related to bad eating habits. Now let's move on to the symptoms of diabetes, which include frequent urge to urinate, excessive hunger, excessive thirsty, mood changes, nausea and vomiting, visual change, blood version or tingling in the feet. The diagnosis. The diagnosis of diabetes is normally made through three tests, namely fast blood glucose. This is a test that measures the blood sugar level at the time it is taken, used to monitor diabetes treatment. Glycated hemoglobin. This is the test that evaluates the fraction of hemoglobin, a protein inside the red blood cell that binds to glucose. Glycated hemoglobin values will indicate whether or not you have hyperglycemia, starting an investigation for diabetes. But what is the difference between these two? Fast blood glucose is used to detect an increase in sugar at the exact time of collection and also to monitor the disease. Glycated hemoglobin is used to get an idea of whether the individual is complying with dietary reeducation, as the red blood cell protein is analyzed, which has 120 days of life within our body. And finally, the third test is glycemic curve. This is the test that the glycemic curve. This is the test that measures the speed at which your body absorbs glucose after ingestion. The patient ingests 75 grams of glucose, and the amount of the substance in their blood is measured 2 hours after ingestion. Reference values are less than 100 milligrams per deciliter on an empty stomach and 140 milligrams per deciliter after 2 hours. A result greater than 2000 milligrams by this limit is considered suspicious for diabetes. Now let's discuss about the treatment. The treatment for diabetes aims to control the glucose present in the patient's blood prevent the sugar concentration from showing spikes or drops throughout the day. This way, it is possible to alleviate symptoms, improve quality of life, and avoid more serious complications. The treatment for type 1 diabetes. The main treatment for type 1 is injectable insulin. This use must be daily, with the aim of increasing the concentration of this hormone in the body, as the pancreas is ineffective. Insulin must be applied directly to Insulin must be applied directly to the subcutaneous tissue. The best places for applications are the abdomen, thighs, arms, waist area, and buttocks. In addition to taking insulin, it is recommended to maintain a healthy and well-planned diet to avoid blood glucose spikes. Practicing physical activities is also essential. In some cases, the doctor may prescribe oral medications for treatment. Now, about the treatment for type 2 diabetes. Includes changes in habits such as physical exercise, diet planning, reduced consumption of sugary foods, and simple carbohydrates, in addition to checking blood glucose levels. In some cases, it is necessary to use medication for type 2 diabetes. This is the case. Alpha glucosidase inhibitors, sulfonylureas, injectable grenades, and insulins. The treatment for prediabetes in most cases consists with guidance on changing lifestyle habits. In some cases, the responsible doctor may choose, together with the patient, to start treatment with medication to prevent the progression to diabetes. What if diabetes is not treated? What are the complications? Well, the possible complications is arteriosclerosis, where the hardening and thickening of the artery occurs. This causes blood flow to be impaired. Diabetic um, foot. This condition can progress to ulcer or gangrene, death of the body tissue. Diabetic nephropathy that affects the blood sugar circulation of the kidneys, cause changes that do affect their function. Diabetic retinopathy characterized by lesions that appear on the retina of the eye, which can cause small bleeds and, as consequence, loss of vision. Diabetic neuropathy, which consists of nervous disorder caused by diabetes. Over time, people with the disease can suffer damage and may experience symptoms such as tingling or numbness, pain, imbalance, muscle weakening, trauma, low blood pressure, and digestive disorders. Other complications of diabetes are myocardial infarction, stroke, and implantation damage to the immune system, favoring the development of viruses, bacteria, and other microorganisms. Now you might be wondering, is there a cure? Unfortunately, diabetes has no cure. However, the disease can be fully controlled through proper treatment and other care that the patient must follow. If the person developed it secondary to the bad habits, it is possible for blood sugar levels to normalize with control of these conditions, which is often seen as a cure. Now let's talk about prevention. For those who want to know how to prevent diabetes, a series of habits should be part of your routine, especially among patients who have a family history of disease or have the diabetes. This is case of maintain adequate weight. Do not smoke. Control blood pressure. Avoid medications that could potentially harm the pancreas. Practice regular physical activity. Well, if you have come this far and like my content, leave a like, comment, subscribe to my channel and activate the bell to receive notifications of more videos and share with your friends and family. Bye.